One of the scariest things about traditional surgery is the word surgery. What's nice about using a laser is that usually there's nothing terribly sharp that's being pointed at you. Yes, you still need to get anesthetized or get numb, but during the procedure there's nothing scary looking. And after the procedure, there's usually significantly less postoperative discomfort. What's really nice about lasers is that instead of traumatizing the tissue, what we can do is we can ablate or essentially explode the small water molecules inside of tissues so that you have a clean wall, which produces less signals around a cell that could lead to discomfort. There are different types of lasers, and the way that they attack the tissues work in different ways. The way that they usually measure this is in wavelength. Now, a lot of laser dentists use what's known as a diode laser. Diode lasers usually head for pigmented or colored tissues. Colored tissues are usually the most surface tissues or at the top layer. What the lasers that we use are usually of a greater wavelength that add directly towards the water inside of a tissue, so or whiter tissues. So it can head for it can be aimed directly at either the soft tissue that we're aiming for or the hard tissue, and we can control that by controlling the power settings. What I love about using the Waterlase is that I can really control the surgical field that I'm working in. I don't need to visualize every aspect. As much as visualization and directly seeing what I'm doing is important in certain procedures, in other procedures it's better to be able to just make sure that everything stays sterile and clean. The laser is significantly less traumatic and has less discomfort using it than any other traditional method.